Thanks very much, Chair. I think that we adjourned debate last time on a very important motion related to this bill, which specifically respects the data that has been egregiously reported here in this committee with absolutely any evidence. And certainly as we begin to look at that, I think that we need to return even to the original omnibus bill, in which the changes that originally occurred, transforming natural health products to therapeutic products, which was done, of course, in as I said, in an omnibus bill, which attempted to hide that, I think, to the public. That being said, during that original time that we heard from witnesses from Health Canada, and we specifically heard from Dr. Supriya Sharma, we know once again that data was referred to which has never been substantiated. And the sad fact of the matter is that simply because the obfuscation of witnesses who were here this time, they absolutely refused to provide that data. And the sad part of it is, in spite of many disagreements we've had at this committee, we have had the ability to have documents tabled here, which has been a regular occurrence, thankfully. And it's something that we've agreed to. Sadly, that couldn't occur at this time. And subsequently, I moved a motion for ISMP to provide the dates of occurrences, the specific substances that were in question, the outcomes, etc. And it's interesting, I had the opportunity to review the footage from that meeting, and I asked representatives from that group 3 times to come forward and provide data to substantiate their claims. And each time they talked about privacy, they talked about, it was very unclear what their point was. My point, though, is very clear. If you want to come and make claims about an industry that is a $13 billion industry that is mainly comprised of small and medium-sized businesses here in Canada, that is an incredibly important, often a family business, often run by women, then you need to substantiate your claims. And that is something that is absolutely egregious not to be held account by our Liberal and NDP counterparts who adjourned debate on this particular motion at the last meeting. So, on behalf of those entrepreneurs who really want to be able to continue to ply their business in our country, shame on the Liberals and shame on the NDP for adjourning debate. We could have settled this already, but once again, for reasons unbeknownst to me, perhaps it is the return of the marriage of the NDP and Liberal leaders, despite the much touted public tearing up of the agreement. Clearly, everybody knows that the renewal of vows has reoccurred. So as we begin to look at that,
point of order from Mr. Julian.
I'm certainly questioning relevance because Dr. Ellis is off on a tangent, but I'm also a little bit perplexed. This is really important legislation. I'm glad that Mr. Calkins is here with us today, and we have important amendments to consider on the bill. Perhaps Dr. Ellis could share with us why he's filibustering this bill.
Dr. Ellis is talking about things that were relevant to the bill, and I expect at some point he's either going to introduce a motion either to resume debate or a brand new motion along the same lines. That's what I'm waiting for, but he's on a topic that will lead to that. We'll see where it goes. Do you have a point of order as well, Mr. Thériault?
Oui, Monsieur le Président.
Yes, Mr. Chair. I believe, if I understand correctly, that Mr. Ellis is trying to provide a preamble to the work we're about to do. I would agree with allowing each party to provide a preamble, an opening statement, if you will, before we get into our work here. I mean, I would, a preamble also to provide before we get into the study. We heard a lot of things from his part, and I want to really look at the framework for the amendments before we get into the amendments. So if people agree, we could provide a certain amount of time, and I don't need more than 2 minutes personally, 2 minutes and a half to provide my own preamble or statement. So that's what I wanted to say. Perhaps Mr. Ellis could conclude his preamble.
Moi, j'ai une...
I have a document indicating the process we're going to follow, but if anyone raises their hand, I must recognize them, and if they have something pertaining to the study, if it's relevant, they have a right to raise it, as was shown by Dr. Ellis. So I'd like to add my name to the speaking list then. Ms. Goodrich, you're next, and then you.
Thank you very much, Chair. You know, in spite of efforts, again, to silence this very important topic of data production in the face of, again, egregious and unsubstantiated claims directed towards the natural health product community, I think it important that we really need to set the stage so that folks who are out there listening, and again, I want to bring people back to the fact that I know that every member of this committee, including Dr. Pawlowski, Dr. Hanley, perhaps not Mr. Nakvi because he wasn't there. I know Ms. Sidhu has been here throughout this entire disgraceful episode. But we received more correspondence on this particular issue with respect to natural health products than any other issue that has ever come before the Health Committee in the 3 years that I've been here. Everybody, and I know that we've brought them to committee before, stacks upon stacks upon stacks of people reaching out and saying, do not take away my access to natural health products. And once again, what we have heard from witnesses who have appeared here, again, I'll refer back to the original omnibus bill when the officials from Health Canada said here very clearly, you can search the database for yourself. So when we asked that, and this is why, Chair, this is particularly important. When we asked them where the numbers came up and what the particular adverse effects were, they said, you can search the database for yourself. Would you table the actual adverse effects in writing with the committee? And the answer we got back was the exact same answer, which is disgraceful, which is exactly why I think it important to have this motion acted upon and the data brought forward on behalf of families and entrepreneurs who have natural health products and businesses for natural health products, which is a $13 billion business in Canada. So when we asked Health Canada officials that question, they said, oh, go look at the database yourself. When we said, table that with the committee, the exact same answer came up. Go and look at the database yourself. And I don't know how many people around the table here tried to look at the database. We spent hours attempting to look at that database, which we should never have to do, but to substantiate the claim of Health Canada with respect to natural health products.
Excuse me, Dr. Ellis, I'm sorry. Somebody has a cell phone that's close enough to the microphone and is vibrating, and we just got an indication that it's probably not good for the interpreters. So, okay, go ahead, Dr. Ellis. Sorry for the interruption.
No, that's okay. So again, we spent hours of our own time in our own office looking at this database and trying to substantiate the ridiculous claims of the Health Canada officials, which again, because of the nature of the database, it is impossible to do. That was the first instance to say that moving a motion to compel purporters of claim to actually table that information why it's so important and why that motion was very, very specific in what it had asked for. Then the second instance we had, and I know I've mentioned this before, but I think it's important to try to put this all in one package. Dr. Supriya Sharma, who was here at the same time with the original omnibus bill, who claimed, sadly, that a child who died in Alberta, it was the result of natural health products. And that was very clear that the result, that it pains me to bring this up again, but it's such an egregious and untrue claim that it bears repeating, because the child died, if I'm not mistaken, of viral meningitis. And for a physician to be here as a representative of the government working with Health Canada, I think that is shameful to say that that child died due to natural health products when that is absolutely untrue. I was going to call it a lie, but I'm not going to call it a lie. I'm just going to say that it's absolutely untrue. And that's absolutely shameful. And so then we came back because our great friend, who happens to be here at the table today, realized that the classification of natural health product as therapeutic products is what allows the cascade of ridiculous events, meaning that therapeutic products will then be required to have significant labeling changes with tiny font, increased use of plastics, labels that are going to fall off because they're going to be so huge, that then the cost recovery program can also be enacted, much contrary to the comments of Minister Holland, who said that the change in definition wouldn't change all of those things, but it is the change in definition which allows all of those things to happen. So then we also heard, of course, representatives from the anti-smoking and anti-nicotine group who were here, who suggest that nicotine should not be part of the natural health products regime, and that they wanted to specifically fight the bill based on that. And then, so then when you begin to look at that, you know, there's easy ways to make these things happen in terms of removing nicotine-containing products from the natural health product legislation. The other group, of course, I mentioned already, ISMP, who were here, who mentioned 700 claims of, since 2019, of side effects related to natural health products. Now, they were, again, very unclear in what they presented. One of the claims, if I remember correctly, and again, I looked at the footage, was that somebody read the label wrong, got the wrong product, and was upset because they couldn't get a refund. Now, I don't think that that is a side effect from a natural health product. I think that's a side effect from not reading properly. But that's my own opinion. All the way to their egregious claims of multiple deaths. Now, again, why is this important? It is important because people should not be able to come here and make egregious claims without data to support what they are saying. We even had a physician from Sick Kids who was here saying that multiple children died because of natural health products, but once again refused to provide any cases. I asked that physician specifically, how many children were there? What did they die from? What was the toxic substance, et cetera, and there was no answer provided. So it is this comedy of events, they're not even errors, and it's certainly not funny that people come here and make egregious claims against the natural health product industry, and nobody here, besides the Conservatives and the Bloc, want to hold them to account. The NDP Liberal Coalition wants to adjourn debate on this specific motion, and clearly that they do not want to have this
Point of order
information
from
before
Mr.
committee.
Julian.
Again, Mr. Chair, I want to cite relevance and repetition, and I'm kind of flabbergasted. This is a bill that the NDP supports, that Mr. Calkins has presented. We have important amendments to consider, and it's being filibustered by the Conservative health critic. I just don't understand at all the objective, but he is repeating himself, and he's not relevant to the debate. And I would ask you, Mr. Chair, has he actually moved a motion, or is he just speaking?
He hasn't moved a motion. He is just speaking, but he is speaking to the bill. It's hard to say that it's not relevant. I'm sorry, Mr. Julian. Go ahead, Dr. Ellis.
Well, thanks very much, Chair. You know, and again, I want to point, I think this is worthwhile pointing out, and I know it's painful to Mr. Julian, but the sad part is that Mr. Julian was that we knew that the Liberals were going to vote against this because, of course, they moved the original bill to gut the natural health product industry. And I think it's shameful for Mr. Julian to have been the one to adjourn debate on bringing forward data that is specifically related to this bill and to the natural health product industry, from which he claims that he's a huge supporter. Now, not to mention the fact that one of his amendments that he has brought forward is basically a wrecking amendment towards Bill 368. And as you begin to consider his amendment, I think that we'll find that we'll ask you, of course, Chair, to rule against the admissibility of his ridiculous amendment as we go forward. So with that, I think it incredibly important that we resume debate with respect to the data that we have requested at the last meeting related to the natural health product industry, because it provides important context for Canadians to understand that by and large, this is an industry which is safe, which is effective, which is proudly Canadian, which, if the NDP Liberals are allowed to have their way, will wreck the industry, will drive businesses out of Canada, and force Canadians to purchase products online, which, again, will never be tested up to Canadian standards because there's no law requiring them to. They will be able to access products from any jurisdiction which they wish. And we have an opportunity specifically to ensure an industry which we've heard multiple testimonies related to the safety and the interest of those involved in the industry, of how safe and they're willing and open to have changes. We've talked to them that they're willing and open to have changes with respect to removing nicotine-containing products from natural health products. And we also know that the concept of recall, and I know that our colleague from the Bloc has submitted specifically an amendment with respect to recall that we certainly would support, which makes perfect sense. We heard clearly that inside the industry that moving amendments related to those two things would make perfect sense. So, very specifically, Chair, with those things in mind, I move that we resume debate on the motion I proposed at last committee meeting, which was adjourned by the NDPs and Liberals, to demand that ISNP bring forward data that they cited at that last meeting as well with respect to natural health products. Thank you.
A motion to